Hello, good morning, students. How are you today? Hopefully, you're in good condition, even though the weather in Semarang lately is not so nice to us. Some of my friends complain about the flood. Maybe you have the flood as well, but it's okay. We are strong human, aren't we? And we're dealing good with the sorrow that we've uh, facing in our life. So it's okay. Yeah, keep on your spirit to learn, to study, since you know and I know the education is the key to the better future. Okay, let's go to our learning course. And our learning course now is about presenting opinion. Yeah, I really hope that after I give you this case study, you will give me your opinion and you give the opinion in video presentation. Therefore, I will wait for your video presentation which the content is about your opinion about the case study. Sir, what is the case study about? It's about pain relief. Yeah. You know, when you meet me, if I am your teacher or your lecturer, it's always about the main topic, the main purpose is about studying human dignity, raising the value of humanity, learning about morality. Yeah, because that's the basic of my education. Okay, now I will give you the case study. Case study 9, pain relief. Mrs. TC is 28-year-old prison inmate. She was approximately 7 months pregnant when she gave birth to her child. Prior to the delivery, Mrs. GC was transferred from Correctional Facility for Women to the Medical and Classification Center to facilitate closer monitoring of her pregnancy. So she lives in prison, right? Mrs. GC lives in prison, and because she was, more or less 7 months pregnant, she was moved to the medical facility for the pregnant women in prison. Okay, Mrs. GC had 5 prior pregnancies. Whoa, before she was pregnant 5 times, most of which were preterm deliveries. This fact was documented in the MCC records. At approximately 7 p.m., so it's evening, Mrs. GC began bleeding and felt severe pain in her lower abdomen. She went to the health services and was seen by nurse R, so the name of the nurse is R, without taking Mrs. GC's vital signs, performing a vaginal examination, or attempting to monitor her to the baby's heart tones. Nurse R sent Mrs. GC back to her living unit and told her to return when the contractions were 6 to 7 minutes apart. Okay, just checking Mrs. GC for a few minutes, touching the vagina, and then put her back to her cell. At approximately 9:30 p.m., Mrs. GC's pain worsened. Uh, she returned to health services and reported to the nurse that she was still bleeding. So she is still bleeding, with severe pain in her abdomen, and her contractions were 6 minutes apart. Nurse R placed her hands on the exterior of Mrs. GC's abdomen, yeah, and note that she was unable to feel any contractions. Nurse R monitored her baby's heart tones, which were 142 beats per minute. Okay, despite concluding that Mrs. GC was in possible early labor, Nurse R sent her back to her living unit and instructed her to return to health services only if the bleeding increased or the contractions intensified in severity or regularity. Following Nurse R's instructions, Mrs. GC returned to her living unit. She sat on the edge of her bed, her pain mounting until 11:25 p.m. I'm male, so I cannot imagine how severe the pain Mrs. GC's had since from 7 p.m. until 11:25 p.m. For hours she was having her pain because of the baby, yeah? And bleeding. Yeah. When she began to scream, oh, she was screaming from the intense pain and moved to the seventh floor where she lay in the fetal positions. It means when you got in fetal positions in psychology perspective, it's unbearable pain you have mentally or physically. That's why you just act like the beginning of your condition as a baby, fetal position. It's very severe pain, unbearable pain. At approximately 11:45 p.m., Mrs. GC was transported from MCC to the hospital. Shortly after arriving at the hospital, she delivered a premature baby boy at 12:20 a.m. Neither Mrs. GC nor the baby suffered any complications during the delivery. The baby was later released from the hospital to the care of Mrs. GC's mother. Okay, in the end, in the end of the day, the baby is saved and the mother is saved. But we have a question now. Based upon Mrs. GC's pain and suffering, should Nurse R have acted differently? So, because in my opinion as a male, it seems like Nurse R just ignoring the pain of the patient. But in the end of the day, we know that the baby is safe, and Mrs. GC is already safe as well. So, is it true or untrue the deeds acted by Nurse R? So, I'll give you the example of opinion. For example, the question, yeah. Based upon Mrs. GC's pain and suffering, should Nurse R have acted differently? No, for example. Since Mrs. GC experienced nothing different from what most women endure during childbirth. Yeah, I think almost all women, they having pain when they have a childbirth. Nurse R could not have done anything to reduce Mrs. GC's pain and suffering, even if she had sent her to the hospital. The fact that Mrs. GC gave birth to a healthy child without complications in the labor demonstrated that Nurse R acted as she should have. So it's okay. Or option B, yes, Nurse R should acted differently. She should have transferred Mrs. GC to hospital at 7 p.m. So the pain, the severe pain, should not be what should not be happen like that. I mean, the patients at least feel comfortable because she is not in jail, but she went to the hospital. So she could have received medical treatment, yes, just like I said, to reduce her pain and help her give birth to her child with dignity and less pain. Yeah, because it seems like she almost gave birth in prison. Nurse R violated Mrs. GC's human right and dignity by her acts. So, which one do you choose? And tell me with your own language. The question, based upon Mrs. GC's pain and suffering, should Nurse R, if you are the ethic counselor or ethic members in the hospital or in the prison, what is your opinion? Should Nurse R have acted differently? No or yes? So I wait for your answer, and hopefully you are having a good life, even though the weather is not really certain until a few days ahead. But it's okay. Keep on spirit on your life and get better future. Good luck.